Japan, Part 126. Only about 10% of the Japanese over 65 are not living with a spouse or child. The pattern of elders living with their children does impose a burden on the young people, especially upon the young housewife, and this is a cost that needs to be considered in this system. The advantage for the elderly is quite clear. Even in old age, the Japanese continue to be active, to maintain strong social ties to their families, and to engage in work and hobbies. Although the percentage of working men over 65 has declined slightly since 1960s, in 1973, while 48% of the Japanese were employed compared to 40% of the Americans, 47% of the Japanese men over 65 were still in the labor force compared to about 15% in North America and the West European countries. In 1976, 43% of the Japanese men and 15% of the Japanese women were 65 were still working. Palmore concludes that the relatively high satisfaction of the elderly is related to a high activity level and to their involvement in the family affairs. The low pension payments until recently have made this a necessity. But in general, Japanese individuals in the households are taught to be more aware of the needs of others and have therefore adapted more easily to three-generation households and to the young couples living near elders than in comparable American families. The Japanese employment system operates to give more encouragement to youth. Middle-aged people save for old age because when employment comes, the burden will fall more heavily on them. In 1977, although the growth rate in Japan had slowed considerably, there were still roughly 2 openings for each young applicant entering the market because of the permanent employment system, whereby companies are motivated to hire inexpensive young workers, compared to the United States, where unemployment is especially high among the young. The Japanese system reduces alienation and pessimism at this crucial stage of life when attitudes towards work are in their most formative stage. There are many in Japan, including the leaders of the Japanese Medical Association, who would argue that the system of having different welfare schemes for different companies and other groups of the population is feudalistic. Hold over that it should be rationalized by having a more unified, standardized national welfare program for everyone. Clearly, the greatest disadvantage of the system is that the unattached individual does not receive as complete coverage of the various benefits as those attached to the largest companies. The large companies' health and pension funds thrive and grow while government-sponsored funds for self-employed individuals are in chronic deficit. Certain groups in Japan suffer from the disparities to an extent that many civic-minded Japanese consider undesirable and that the vast majority of the Americans would consider undesirable. Minority groups like Koreans, perhaps numbering 600,000, and the descendants of the outcast, perhaps numbering 2 million, often have much more difficulty finding employment in the middle age and have much less adequate welfare provisions. Widows and divorcees not only receive inadequate coverage from the protection plans, but even those who wish to enter the labor force are handicapped because they have not accumulated seniority and thus receive far less pay than other workers of their age. Those from small industries who seek new jobs at the middle age have very little chance for sharing attractive living conditions. No benevolent-minded person in Japan or the United States would find the extent of these differentials attractive. Despite ups and downs, the long-term trend of the Japanese welfare programs of the Social Insurance Agency has been gradually fill the gaps in groups which were inadequately covered